right. Hi, everyone. Good morning, good afternoon, wherever you're calling in from. My name is Sarah Martin. I am the facilitator of the GBV AoR Community of Practice. And welcome to our second webinar that we're doing in collaboration with the Women's Refugee Commission on IASC Guidelines on Inclusion of Persons with Disabilities in Humanitarian Action. For those of you who aren't familiar with the GBV AoR or the Community of Practice, the GBV AoR is the global working group through the IASC that responds to gender-based violence in emergencies. And we have a community of practice, which is over 800 specialists who work on GBV in emergencies all over the world. I see many of you here in the webinar, so welcome and thanks for joining us. And Women's Refugee Commission is a research and advocacy organization focused on women, children, and youth displaced by crisis and conflict. You can see there a little bit more information if you want to join. And Emma Pierce has very graciously, she's one of our experts on GBV and disability, working with the Women's Refugee Commission as a consultant, has very much kindly offered to help organize these series of webinars because we wanted to highlight the gap that we see in gender-based violence programming sometimes with inclusion of persons with disabilities. So last week, we did an overview of the IASC Disability Guidelines, and the recording is available in the Dropbox, which we'll share later, for anyone who wants to see it. And for community of practice members, you can get it on our website as well. Today's webinar, we're going to dive a bit more deeply into recommended actions for disability and inclusion. We've got a number of great speakers with us here today who are going to share their experience, and it's going to be much more practical. And then we welcome you next week to join us to talk a bit more about how we can actually move things forward. It'll be more of a brainstorming and hands-on session, whereas these are more about presentation. Okay. We're going to be sharing a lot of tools and resources today. But before we begin, let's go over a few little housekeeping rules. Please keep your microphone on mute to reduce any background noise. Go ahead and type into the PowerPoint, type into the chat box any questions you have. I just noticed that someone was asking if the video is not visible of speakers. I've been having some connectivity issues, so I've turned off my video for the speaking today just to make sure that I don't drop off the internet. But that does point out to me an important thing that we need to all be aware of, which is closed captioning that we've made available today. On the bottom of the Zoom screen, you can see a button that says closed caption. On my screen, it's down towards the right. I really recommend that you click on the CC button in order to be able to get the closed captioning. And we really thank our colleagues at A-Media, they're helping us with the closed captioning today. Thank you guys. We are recording the webinar right now, and it will be posted online again. We do have a YouTube channel through the GBV AoR, and you can get it on the GBV AoR website. All of the presentations, tools, and resources are going to be uploaded again to this Dropbox link, and we'll put it in the chat box so that you can easily get to it. And we do circulate it again with the PowerPoints and the recording after the session is over. We have also tried to put in screen reader accessible formats of the materials when they are available that are also in the Dropbox. So please go on into the Dropbox. It's open to everyone, and you'll find a wealth of materials that Emma has put together for you. And thank you so much for that, Emma. So last week, there were a few questions and comments. People were asking about guidance on disaggregating data by disability. So I wanted to point out that you can look here in Annex 2 of the IASC Disability Guidelines and find more information on this. You know, in our gender-based violence programs, we don't always collect detailed quantitative household data. We're more qualitative types, and we do more kind of different ways of doing that. So it's really important for us while we're doing consultation processes to include disability and persons with disability, and to look and to be aware of these things. We also really need to make sure that the materials that we develop for community awareness raising are also available in different formats for those with disabilities. Again, more tools and resources on these topics are going to be discussed in today's webinar. So for your question, please go ahead, type it in the chat box. We'll be monitoring the box and make sure that all of you get a chance to ask your questions today. And if not, we'll talk about them next week too. All right, so without any further ado, I'd like to introduce Emma Pierce from the Women's Refugee Commission. Thanks, Emma.
Hi, thank you, Sarah. Thanks for that introduction, and thank you to everyone who's joined us for this second webinar. Today, we're going to spend a bit more time looking at some of the detailed sections in the IASC Disability Guidelines. In particular, we're going to have a look at the sections that are specific to GBV programs, and there are some sections in there that give recommended actions for those of us that run GBV programs. As a reminder, we touched on this last week, but there are 4 kind of overriding must-do actions that we should be applying to any kind of programming that includes GBV programming, and also considering this at all the different phases of the programming we have, from assessment and design through to implementation and then monitoring and evaluation. The first one is to promote meaningful participation, and that's not only as beneficiaries, but also as stakeholders in our GBV projects, people who can give us guidance and advice on how we need to adapt our programs and projects. The second must-do action is to empower persons with disabilities and support them to develop their own capacities. And we're going to hear from later on today from some colleagues from Kenya and also from Pakistan about the different actions that they've been doing with organisations of people with disabilities and empowerment of women with disabilities. So I think that'll be a lot for us all to learn from. The third point is, and we spent quite a bit of time on this last week, is about analysing and removing barriers. So thinking through what those different barriers are that are preventing people with disabilities from accessing or participating in our program on an equal basis with others, and then figuring out some strategies to address those. And then the last one is disaggregating data, both qualitative as well as quantitative, for monitoring of inclusion. And so here you might be thinking about how you, monitoring how many women and men with disabilities attend some of your community awareness raising or GBV prevention activities that you run in communities. Within the IASC Disability Guidelines, there are sector-specific sections, and within the protection section, there are some specific recommended actions for GBV programs. So I'm going to go through these today. These recommended actions are separated out according to the different phases of our programs. So the first phase, which is usually assessment, analysis, and planning, there are a whole range of actions here that we can consider. The first one is including persons with disabilities in age and gender appropriate consultations. So this could be as simple as when you're running a group discussion with women in a refugee camp or in an affected community, making sure that we identify 1 to 2 women with disabilities to join that discussion, to share their perspectives as women, but also to bring in that diversity and disability lens. We also could assess attitudes and assumptions of staff and service providers. We heard last week that that attitudes can be one of the biggest barriers to accessing services and programs. So spending some time assessing attitudes and assumptions of both our own staff and service providers is a really important step. We can map local organisations of persons with disabilities, their skills and capacities in gender equality and GBV prevention and response, and think about collaborations that are in line with the mission and interests of both organisations. And we're going to hear from organisations of women with disabilities and persons with disabilities later today. And you can invite these groups to help you define your GBV priorities, particularly when you're running your subcluster or subsector meetings. You know, think about inviting some of these organisations of women with disabilities to participate, because they can help us to define those priorities as they relate to persons with disabilities. And a really important point here is to ensure that whatever we're assessing in this phase, that we actually translate that into planning. There was a rapid review undertaken by ELRA last year looking at disability and older age inclusion in GBV programming in humanitarian context. And that actually found that that review actually found that there is a lot of assessments out there that are conducted that don't translate actually into changes in practice or programming. So it's really important to make sure that we take what we've learned in that phase and actually integrate it into our proposals, which brings us to the second piece, which is about resource mobilisation. So we can develop proposals that actually address the barriers that we've identified in the in our assessments, and we can allocate some resources in our budgets to improving accessibility and inclusion. These don't need to be big budgets. They can be small amounts of money that you can draw on when perhaps you need to pay for transportation for a support person to join someone with a disability in one of your trainings, or for a sign interpreter if a particular participant might require that. So just keep that in mind, that sometimes a small budget like that can help. In terms of implementation, we obviously have a lot of actions here. One that we've found has worked really well in some contexts is actually recruiting persons with disabilities as staff, volunteers, and community mobilisers. However, we do want to raise the importance of looking at the gender balance of the persons with disabilities among the persons with disabilities that you recruit. We do have some examples where GBV programs have recruited volunteers with disabilities, and when we've gone and met those volunteers, we've found out that a lot of them might be men. And so it's really important for us to make sure that we have both men and women represented among our volunteer group, because their experiences will be different. You can integrate content about persons with disabilities in your GBV training packages, as well as in your community awareness raising. And I'm going to show you some tools in a moment that you might want to go and look at and draw on to do that. We can train local organisations of people with disabilities, particularly those that are led by women, on safe identification and referral. These organisations are often in regular contact with people with disabilities, and training them on safe identification and referral can really help to support support women with disabilities who are survivors to access services and assistance. There are a lot of examples in different humanitarian contexts now where there have been efforts to strengthen national policies and protocols, particularly standard operating procedures in relation to inclusion of persons with disabilities. There's some examples, I believe, in Jordan, in Lebanon, and also I think in Indonesia, we've got some examples, and we've put those actually in the Dropbox for those that are interested. Our PSEA mechanism, so that's protection from sexual exploitation and abuse, and those mechanisms that we have in place to monitor and respond to reports in relation to that need to be accessible. People with disabilities need to know how to access those systems and how to report PSEA if they experience it. And likewise, we need to make sure that all of our other feedback and complaint mechanisms are accessible to them. Something that's more obvious is, making sure that if we are building facilities, so in some cases we are reviewing, we might be building or renovating a facility to become a women's centre, making sure that our engineers, our construction teams know the basic universal design principles and can apply those in any renovations or building facilities that are happening. And then lastly, the IASC Disability Guidelines do talk about remembering our peace building efforts. Now, I'm not sure how many of you are involved in peace building efforts, but obviously, that's a division of GBV programming that that oftentimes lacks a bit of diversity in terms of who is participating. So thinking through with those peace building efforts, how women and girls with disabilities might be able to contribute and participate throughout the process would be a really great strategy. Moving on, under coordination, a really simple thing is if you're having a GBV coordination meeting or, a gender and humanitarian action coordination meeting, because I know a lot of us cross over both the GBV and gender spaces, just making sure that there's a standard agenda item so that disability is raised each time and responded to each time. That can sometimes be a really useful approach. And making sure that we share information that we have about the needs of persons with disabilities with other sectors. And that could include human rights monitoring mechanisms in some cases, in some countries and contexts. Lastly, when we talk about monitoring and evaluation, you can monitor the number of persons with disabilities who are attending our GBV, our gender equality, our women's empowerment activities. This isn't so much about going house to house and identifying people with disabilities as it is about identifying who is accessing our programs and activities and who perhaps is still missing that we might want to do some more targeted outreach to. And there is also the option to disaggregate our GBV IMS data. That's the GBV Information Management System, which is essentially a system that collects information from survivors of violence who are reporting to case management. Now, we all know that this is not a reflection of the prevalence of GBV in any community because there's far more usually happening than is being reported to case managers. And even those that report to case managers can elect to not have their data put into this system. So, but it still does give us some information that we can analyse and look at. Are people with disabilities accessing case management or not? And of course, this needs to be in line with safe and ethical data collection and sharing practices. So please always keep that in mind when it comes to monitoring and evaluation in GBV programs. So some tools and resources. I know last week we talked a lot about the Washington Group questions, and there is more information, as Sarah mentioned, in the IASC Disability Guidelines in relation to those particular that particular set of questions that you can integrate into household surveys, but also a range of other quantitative data collection tools. Today, I wanted to share with you a bit more some of the qualitative tools that we have out there. So this is a toolkit that we developed, the Women's Refugee Commission developed in partnership with Child Fund International. And whilst it is focused on engaging children and youth with disabilities in community-based gender-based, risk assessments relating to gender-based violence, I think it's a really interesting structure and process that you could use in the community for participatory assessments on GBV risks and risk mitigation. So I would encourage you to go and have a look at this tool on the Dropbox. It actually gives a whole series of steps. First of all, it gives you a description of who we want to include in our GBV assessments. And some of the language that you're going to see in this piece of the tool is actually drawn from the Washington Group short set of questions. So those questions are definitely valuable, but we just use them in a different way in a qualitative assessment. And then it goes on to give you a series of steps that you can do to really engage children and young people with disabilities in activities, community-based activities, namely assessment processes. And of course, that starts with raising awareness in the community and giving information to people so that they can decide for themselves whether or not they want to participate. So I'd encourage you to go and have a look at that. I actually wanted to copy, I've actually cut and paste out of the tool here, tool 1, which actually gives some awareness raising messages for the community. And the actual key messages there are, are only a handful of messages, which we have tried and tested many, many times and found really effective. And it's describing to people in a very simple way who persons with disabilities are, highlighting to people that we want to learn from them, we want to hear from them, which I think is a really important step to actually invite them and to say, we'd love for you to come and join us in this activity. stressing that it is voluntary and that they're not going to be, they're not going to have any negative outcomes if they decline to participate. And then highlighting that there's going to be a lot of different ways that they can contribute or participate. So this tool is really useful in that it has some really practical key messages that you can use in your community, not just for assessments, for any kind of activities you might be running that you're trying to engage groups of persons with disabilities in. And usually when we use these messages in a community, we find that people start to feel like they're welcome and they actually come forward and ask to participate. So it becomes more of an opt-in process. There is another toolkit. I should say in relation to that Child Fund toolkit, I have to give a call out to Danielle Roth if she's on the call, because she currently works for IRC, but we work together on that toolkit. So Danielle, if you're on the call, thank you. It was a great piece of work. Another tool is a tool that was developed by Women's Refugee Commission in partnership with UNICEF. And again, we have a whole bunch of tools here, not only for frontline workers that are doing outreach and identification and referral, but also for case managers. So go to the Dropbox to find those more detailed things. But I know someone last week asked for more guidance on how to do community awareness raising. And this is just another example of a tool which has adapted messaging around disability and GBV that can be done by outreach workers when they're raising awareness in communities. I'm just aware of the time, so I'm going to start moving a bit quicker. This toolkit for GBV practitioners, also on the Dropbox, was done in partnership with IRC, and it also has an example of how to adapt your information, education, and communication materials. And you can see that this is a really interesting format where there are 4 questions that you can ask yourself to assess any material that you're developing to determine whether it is not only accessible, but whether it's actually representing people with disabilities appropriately as well. And finally, we did mention this last week, but on the Dropbox, for those that are interested in easy to read formats, we have a whole range of examples that are already there. These have been developed in partnership with have been developed by companies that we've recruited and tested with people with intellectual disabilities, and then also tested in contexts. So that doesn't mean that it's going to work in every context, so you should adapt it and test it in your own context, but I did want to share that with you. On that note, I will hand back to Sarah. Thank you.
Thank you, Emma. It's so great to see so many different tools that are out there and available for everyone. I remember when I was first starting out in gender-based violence, this was an issue we were aware of, but thanks to the work of you and all the other people that you mentioned, it's great to finally have some tools. Now I wanted to introduce Abia Akram from the Special Talent Exchange Program in Pakistan. And Abia is going to tell us more about collaborating with OPDs on gender and GBV priorities during COVID. Very relevant. Abia.
Hi Sarah, thank you so much for having me. Thank you, Emma. I think this is really important webinar because we have seen in the time of the COVID and the crisis situation, it's getting really worse to see how women and girls with disability all over the world are facing so many discriminations and adding to the gender-based violence. And it's critically important to address with the collaboration and engagement of all the stakeholders. So at least we can see the practical examples. Thank you, Emma, for all your hard work and creating all the documents with the support of all the key stakeholders, because this is really the time when everyone wants to know what are the practical steps they can take so they can equally engage women and girls with disability, and those who have the experience and those who have the knowledge, like how they can move forward. So I think this is really important. For me today, I will just briefly discuss some of the examples, how we have seen the differences in South Asia and the Asia Pacific region. We did some of the consultations and also came up with some of the suggestions how on the country level with the engagement of the key stakeholders, the UN and international organizations and government especially, how we can engage them in some of the activities to address the gender-based violence. As you all know, like 10 to 15% of the total population are persons with disability, and 50% of them are women and girls with disability who are like confined in the homes and living a life like a prisoners. And now after the COVID, fortunately or unfortunately, everyone have to stay back at home. So this is really critical for them because they are not used to live with the presence of all the family members, and it creates a lot of trauma for them, a lot of restrictions for them. Even they were not able to use their personal assistance services to go to the washroom or to drink water and all that situation. So how we can see what kind of like challenges and the solutions we can address. So we started the discussions on the regional level right after the COVID response. We started online webinars and discussions with women and girls with disability. And we came up with a lot of like suggestions how they can address that. And at the same time, we organized on the country level some of the activities with women and girls with disability to see the positive change we can create. Can you go to the next slide? So we always took disaster as an opportunity because we, during this time when everyone at home, they were like the government stakeholders have really realized like what's the problem and how persons with disabilities are living at home. So we pushed to the government and we asked them, like we have presented a bill quite long ago after like 20 years of continuous advocacy, but this was the time when they adopted the bill and made it the act for Pakistan. So now we have the formal legislation, and then the parliamentarians, they also work with us to establish the parliamentary committee on the rights of persons with disability. And we are trying very hard to get the space to women-led organizations where women with disabilities can strongly talk about their rights. So this was just like one thing we want to share. And then we started building on this policy, how we can connect with the international organizations and some local disabled people organizations so they can take the discussion forward, especially on the gender-based violence. So we have invited the Ministry of Finance, Ministry of Human Rights, and all the line ministries to talk about the implementation of the bill. Next, please. At the same time, we also feel like now the COVID situation, women with disabilities were going through the very strict like trauma, and they were not able, and the psychosocial problems, and they were not able to, you know, use or losing their job opportunities, the one who were doing. So it was difficult for them to understand the whole context virtually. So we trained almost 100 women with disabilities on the advocacy to create online advocacy platform for them. So we have given them the whole trainings on using the IT skills and also how they can, you know, address the issues on the emergency responses and create that platform for power to persuade for women and girls with disability. So with the Election Commission of Pakistan, with the Humanitarian National Disaster Management Authority and some other key stakeholders, we engaged them and we trained those women with disabilities as a master trainer, and then they further trained all over the country, almost 100 women with disabilities to learn the IT skills and advocacy platforms virtually. So they can raise awareness about their rights and use that platforms for further advocacy and raising their voices on the gender-based violence. Next, please. This is just one example. And right after the COVID response, the government of Pakistan have developed like protective measures for women for persons with disabilities on the COVID response, how to protect yourself, how to raise, but that information was not accessible. So what we did, we in collaboration with the government, we asked them to translate that in the sign language. So that sign language material could be used on the media, on the public places, and we also use that as a resource for the universities and colleges for deaf people, how they can understand that language. So then we can spread the messages on the gender-based violence, on the personal capacity, like how you can protect yourself and your community. Next, please. We also try to, like, the one challenge that women with disabilities have addressed was having their own personal hygiene, because they were using the wheelchairs and the personal assistance services was not available at that time. So the mothers of those young girls with disabilities, they were praying like, our daughter die before we die, because nobody is going to take care of them. How we can take them to consult with a doctor, to go to the different places where they can access that information. And it was so complicated, like we were meeting with them virtually and we talked to the parents like, what is the biggest challenge? And they were saying like, we can only do the forced sterilization, because we can't find any other solution during the COVID situation. We can't take them to the hospitals for the general checkups, for their sexual health and reproductive rights. So that was completely missing. So we talk with different organizations how we can provide them the basic like dignity kits, where they can get their own support and they can get also the information package in it. So at least women with disabilities are a little aware what kind of resources they can have. And we also provided them some wheelchairs, some assistive devices, some support mechanisms. So at least within the home, they can feel a little secure and dignified. Next, please. We also find out in during the discussions, like women with disabilities are facing, the unawareness about the humanitarian responses, and the guidelines and the policies are not inclusive. So how we can train on the twin track approach, on one hand targeting to the policymakers, the lawmakers, and all the officials, government officials who are having the control on the services, on the humanitarian responses, and on the other hand, we need to train women and girls with disabilities. So with the collaboration of Women Refugee Commission, we have did the consultations on the regional level, but at the same time, at the grassroots level, we give awareness to those women with disabilities, how to raise your voice, what kind of challenges you are facing, and we can document that as a case study or experience-based knowledge. And then we talk and organize a consultation between the humanitarian actors, so they can accept, especially from the perspective of the IASC guidelines, and also inclusion of persons with disability in the humanitarian responses. Next, please. We also did some of the surveys on the mental health for women and girls with disability, and we realized women with disabilities are going through the psychosocial problems at this time, but how to address it, because it's not easy that you can just hire the psychosocial counselors and they can start working on that, because we need women with disabilities who can do the counseling for women with disability. Because if the non-disabled woman is going to talk to the disabled woman, they are not accepting, because they thought like our challenges, our problems are completely different from you. So how we identified the counselors of women with disabilities who can raise their own voices. Do they have the experience, fully equipped with the technology and knowledge and doing the psychosocial trainings, but we also connected them with the mainstream organizations who have their own helpline helplines, the safety helplines, if God forbid any woman with disabilities is facing the gender-based violence, so where to go, which police station is accessible for them, which place is possible for them to address these challenges. So if a deaf woman is going to the police station, there is no sign language interpreters available. Blind women can't report to their violence case. So these were the challenges, but we tried to connect and with the mainstream organizations network, where we train those women with disabilities so they can further create a network of the peer support on the country level. Can you go to the next slide? Yeah, so we thought like only like trainings are possible, but at the same time they need continuous psychosocial counseling. So we did a kind of a research on the gender-based violence, the mitigation plans, and how the stakeholders are missing that opportunities or the facilities for women with disability. And at the same time, women with disabilities also address what kind of challenges they are facing. So based on that research, we started this virtual peer support network for women with disability so they can get more information and at least be aware about their rights of the inclusion. Next, please. And we also developed the Equal Access mobile application, which contains all the information where to get your like personal checkup for the COVID-19, how you are going to get the personal assistance services, where are the assistive devices available, education, employment, and what are the policies and the legislation which are accessible. So all these information, we have translated that in the sign language, in the video messages, in sound descriptions, in local languages. So it's fully accessible mobile application, which we work together with the Pakistan Telecommunication Authority, because we thought like Ministry for Information and Ministry for IT, they both have to take the responsibility to making this information more inclusive and available for all women and girls with disability. So what we are trying to do, where one of the key component is based on the IASC guidelines and also on the gender-based violence. So women with disabilities can get the notification or they can send us the message if they are facing any discrimination or harassment at home or some kind of challenges, so they can put that notification and they can get some referral mechanism, because disabled people organizations are having the network but still very limited capacity. So what we are trying to do through this mobile application are referral mechanism for all the women and girls with disability and the key stakeholders. Next, please. We also observed the days on the international days, the 8th March on Women's Day, and then we also advise like Girls' Day, because these are the advocacy platforms we can use to create more information about the rights of women and girls with disability from the gender-based perspective, because gender-based violence, because the social media is showing very negative perspective about disability. On one hand, they thought like they are the punishment from God, so we have to, ignore them and don't need to talk to them. On the other hand, they thought they are very close to God, so we just protect them. Or so these are the challenges which all the South Asian countries currently facing. So we are trying to advocate through media, through all the different platforms where we can raise awareness about women with disability, and bringing more visibility of women with disabilities at all levels is very important. It's not only like engaging them as beneficiaries is enough, but how we are taking them from the planning, implementation, and monitoring. So then we can see the positive change, because these women with disabilities having experiences of decades of work. So how we can best use those resources and those pool of women and girls with disability. Next, please. Yeah. Thank you so much. And this is just a small walk which we are doing currently during the COVID response. But for sure, there are so many other platforms where we can connect with each other. And I believe like if we have the commitment and the strong connection with everyone in this kind of platforms, we can achieve much more, and we can see the positive change and the dignified life of women and girls with disability. Thank you so much.
Thank you so much, Abia. That was really impressive to hear about all of the wonderful things you're doing. Next up, we have another great presenter. We have Lizzie Kiama from This Ability in Kenya. She's going to be talking about advancing the rights of women and girls with disabilities through online learning. Thank you, Lizzie.
Thank you very much. Can you hear me okay?
Yes, sounds good and clear.
Great. Thank you, Sarah. Thank you, Emma, for inviting me on this webinar. My name is Lizzie Kiama, and I am the Managing Trustee at Disability Trusts, and our work focuses on advancing the rights of women with disabilities. So I will make a brief presentation around ending gender-based violence for women with disabilities, for women and girls with disabilities. Next slide. So as I said, Disability is a nonprofit working to advance the rights and inclusion of women and girls with disabilities in Kenya. Our main objective is to amplify the voices and increase visibility for women and girls with disabilities. And our mission is to create a world in which women and girls with disabilities have equal opportunities, both economically, socially, and politically, with their rights acknowledged and respected. And we envision a world in which the rights of women with disabilities are respected, upheld, and promoted. We are based in Nairobi, Kenya, but we operate nationally, and we focus on, currently we're focused on 8 counties in Kenya. Next slide. So a little about the background. We know that studies have shown that women and girls with disabilities face up to 10 times more violence than women and girls without disabilities. Women and girls with disabilities also experience abuse for much longer durations because they also feel as though they have fewer opportunities for escape or ending this abuse. While women with disabilities share the barriers that any other woman may experience, women with disabilities face additional barriers when it comes to gender-based violence. Next slide. The description and understanding of gender-based violence has not necessarily been inclusive of the experiences of women with disabilities who are more susceptible to becoming victims of various forms of economic, physical, sexual, and emotional violence. One of the most common is the cultural stigma that marginalizes women and girls with disabilities. And this kind of stigma impacts the lives of women in different ways and puts them in extremely vulnerable conditions. When we look at economic violence, the lack of empowerment, economic empowerment, increases dependency on other people. And this takes away their independence, their freedom of expression, and their right to thrive. Life with a disability also comes with increased isolation and loneliness. We've particularly seen this during the COVID-19 pandemic and the measures that have been enforced during this pandemic. For women and girls with disabilities who have not had a lot of opportunities for social interaction, this reality affects their courage and their capacity to speak up, and also because society places a burden on their experiences and tends to not necessarily believe and take seriously their experiences. The effect of this is increased stigma, discrimination, and disenfranchisement, which characterizes the lives of women with disabilities. Next slide. So how we work, we have focused our work on the experiences of women with disabilities in relation to their sexual and reproductive health and economic empowerment. We work around amplifying voice, where we conduct skills building workshops with communities of women with disabilities. We work a lot in the grassroots, where we work towards building their knowledge and awareness around legal frameworks, their legal capacity, and the possible avenues for redress. We incorporate simplified techniques for using market-based tools. For example, where we might use Google Forms to collect data with various stakeholders, we will use mobile phones to collect the same type of data amongst women with disabilities in the communities. Where we, during the coronavirus pandemic, for example, we began a podcast where we were collecting the experiences of women with disabilities, and we conduct this podcast via Zoom. But when we include, to ensure inclusion of women with disabilities in the community, we also reach out to them and use mobile phones to document and, ensure that we include them in the podcast by recording their audios and including their experiences on the podcast. So it's a more holistic experience of women with disabilities internationally, but also locally from the community. We've also worked on building digital skills. This began last year, actually, but when the coronavirus pandemic happened, we had to re-strategize and look at how we can continue to do this without face-to-face interaction. So we built an e-learning platform where we are building the digital skills of women with disabilities, because we realize, I'm sorry, it's raining where I am, so I hope you can still hear me. So we realized, okay, great. So we realized that digital skills is an important tool for advocacy and economic empowerment. So this platform was built for us to, with the idea that we can incorporate more content on different topics. And that's what we have begun doing. We've also invested in building evidence through data collection. We're doing this using USSD mobile technology, where we're collecting quantitative data on women and girls with disabilities across the country. We also work to build partnerships. As I said, we work in 8 counties. We conduct outreach before we begin any intervention in that particular area. We find out who the local partners are, who's working in civil society and human rights in general. And we reach out to those partners. And what we found is the majority of the time, these partners have not worked with persons with disabilities or women with disabilities in the past. And so we work to build their capacity around disability rights and inclusion, and also introduce them to the local groups of women with disabilities that they can continue, or they can begin to start incorporating them in their work. We also do a lot around creating visibility. We do this in-house. So we develop media products to kind of begin to shift the medical and charity narratives that are prevalent in the media. We know that media is a powerful tool, a powerful platform for public awareness. However, the current representation of women with disabilities in the media is problematic, because there is either a profound invisibility, or when there is representation, it almost always presents women with disabilities as victims. So we use this body of work to build qualitative data of the experiences of women with disabilities, and we center the woman with a disability within the storyline. Our photography and our documentaries, which focus on sexuality and disability, are important spaces for us to begin to dispel myths around asexuality, which plays a critical role in how society prioritizes the sexual and reproductive health of women and girls with disabilities. When the community, for example, does not view a woman with a disability as having a sexuality, then what happens is we are constantly questioning, we undermine, and we exclude women with disabilities in all aspects of their sexual and reproductive health. Next slide. So what can we do? We recommend listening. Listening means we document the experience with women with disabilities. We collect disaggregated data that includes communities of women and girls with disabilities. And this includes across all our tools when it comes to monitoring and evaluation. It means we also involve women with disabilities, women and girls with disabilities, when designing programmatic interventions. And this should be at the initiation stages. It also means we invest in prioritizing the needs and issues of communities with disabilities on an equal basis with others. So for example, if we're investing in employability skills for youth, it's also important that these market-based skills are also provided to youth with disabilities, because they are at at an increased disadvantage, and we need to ensure that we are maintaining a competitive advantage for both groups. We also need to invest in community building through education and awareness to dispel cultural myths and beliefs on the rights of women and girls with disabilities. We also need to align GBV policies and laws with experiences of women with disabilities, focusing on the unique manifestation of GBV in the lived realities of women with disabilities. This will definitely provide more learning and knowledge sharing opportunities. We also have to invest in technology to create safe spaces of capacity building. The pandemic, if it has shown us anything else, it has shown us that we all need to prioritize technology, and this can be a game changer for individuals with disabilities. We also need to strengthen supporting decision-making capacities of women with disabilities across all their diversities. Experience has shown that a diverse group of people is good for business. Diversity increases productivity, creativity, and innovation. Through that, we can develop internal policies that reflect gender and disability inclusion and implement inclusive programming. We can also provide opportunities and empower women with disabilities to own their own processes and control their narratives. We can also partner. We can ensure meaningful representation and participation of women with disabilities in decision-making spaces. Oh gosh. Within boards, management level and programming. We can also rely on organizations of women and girls with disabilities on best practices and continuous learning. They are, after all, the experts. Next slide. You can hear the rain, and I'm done. Thank you.
It sounds great. Okay, well, Lizzie, thank you for carrying on in a downpour, and I hope you're okay and staying warm and dry.
I'm very warm and dry. It's just pounding on the roof, so I'm sorry about that. But I hope you got the gist of my presentation.
Yes, you're quite clear, and even with the loud rain in the background, we heard you well. So Great. Thank you so much, Lizzie. And we will be, you can reach Lizzie. I put the contact information in the background in the chat box. Next up, we want to hear from Ricardo from UNHCR Geneva. He's going to talk to us about UNHCR's age, gender, and diversity approach. Ricardo.
Hi, everybody. Just checking that you can hear me well.
You sound great, loud and clear.
Great, thank you. Thank you for giving this time. My name is Ricardo, as shared, and I work as a protection officer on disability inclusion for UNHCR. I will take a wider focus than what has been shared, which is really practical and really interesting. However, to make these things happen as well, there is a need for having at the global level as well a presence of policies that are seconded or let's say endorsed by the organization and then somehow enforced or communicating through our actions, right? To be as well accountable and to be able to monitor what is happening. So if we could go to the next slide. I've prepared a list of policies. I hope you will not be overwhelmed by the number of policies there. But the idea would be to see how UNHCR anchors its work and principles in different policies, and then how we support as well to our operations to manage those policies adequately, because there's a big amount of information in there. Just very briefly, of course, the CEDAW and CRPD are key frameworks that guide the work of UNHCR, and they are used for multiple purposes. One of them, and just giving two examples, is as a reference when we are developing our own policies, so transforming those legal frameworks into UNHCR policies, but as well in the direct engagement that UNHCR has with human rights mechanisms. For example, the Human Rights Council, the CRPD committee, the CEDAW committee, but as well special procedures. So how UNHCR can support as well monitoring what are the key issues that displaced populations, including refugees, stateless populations are facing in different contexts. But these policies have influenced as well UNHCR approaches and understanding of different contexts. Giving that as an example, on the third line, there is the UNHCR Executive Committee conclusion on refugees with disabilities. This particular policy commitment that was issued in 2010 helped UNHCR transforming the way disability was conceptualized within the organization, and it recognized the convention with its concept of disability as an evolving concept that includes as well barriers in the environment, and acknowledged that services and facilities, including the assistance and programs and protection that UNHCR would deliver, may be inaccessible for persons with disabilities. So it was calling to states, UNHCR and partners to protect persons with disabilities against all forms of discrimination, including discrimination on the basis of disability and on gender. Now, these are very wide policy frameworks. Sometimes it's very difficult for operations to wage what is important, what is operational. So UNHCR developed an additional policy where the different components of diversity are recognized, and that is the age, gender, and diversity policy. And there's an illustration on the right on the latest version on 2018. The policy recognizes the heterogeneity within the population of persons of concern to UNHCR, and it guides our work with all persons, including as well women and girls with disabilities, ensuring through core actions that all persons enjoy their rights on an equal footing. These policy commitments include much more operational actions that are easier to follow up through programming efforts, and we will see later how this can be done. However, policy development has been evolving as well. It was recognized that the UN system was not adequately including persons with disabilities and responding to supporting enough the implementation of the Convention on the Rights of Persons with Disabilities. And in 2019, the Disability Inclusion Strategy was launched to support that joint effort that the UN system could bring. Just giving two examples and how they could bring a change for GBV programming in the field. There are specific indicators such as 9 programs and projects and 11 country program documents that include requirements to provide for the inclusion of persons with disabilities in UNHCR programming. That means that from last year, we started monitoring within the different country, well, first the guidance that we are providing to our field operations, but as well how field operations are integrating within their context analysis and their strategic priorities, and then within their own programming, how disability is being mainstreamed, and that ideally would help as well to monitor where in GBV programming disability has been mainstreamed. In addition, there has been a policy on the prevention of risk mitigation and response to GBV that has been issued this same year. And the policy highlights as well the protection of persons of concern with disabilities against sexual and gender-based violence as an overlooked area requiring attention. I hope that was not too much of a policy word mouth. And the idea is, well, to share that global policies and legal frameworks shape the work of UNHCR. UNHCR is as well shaped, or the concepts that are of disability or gender-based violence are shaped by those international frameworks and transformed into our own policies. And there are efforts both to be able to monitor for different factors of discrimination in a very detailed basis what is being done, but as well efforts to mainstream all those factors across all policies and present these to operations in a way that is manageable, right? Because many times the problem is that there's a perception that there are competing efforts where it should be always seen as complementary efforts. Women and girls with disabilities are women and girls too, and those policy efforts should apply to them as well, right? If we could go to the next slide, we can see a way in which we support UNHCR policy implementation through the operation planning. These are very long slides, but are copy-pasted from a communication that was issued to all operations around, as just giving an example, for the refugee response plans. So what is important to consider is that policies need to be then transformed into operational guidance if we want to help as well operations to use them. The operational guidance includes the IASC guidelines that have been discussed in these webinars. There are as well dedicated guidance on disability within UNHCR. For example, the need to know guidance on working with persons with disabilities in forced displacement, and disability is mainstreamed as well in other existing guidance within UNHCR. And giving just an example, there is a resettlement tool for improving the work on resettlement with persons with disabilities. Now, consulting these guidelines is an action that requires willingness and attention, right? And then field staff needs to voluntarily saying, well, I want to improve this area. I have a gap of knowledge, I think, so I'm going to consult those guidelines to support this happening, but also somehow to enforce some of the recommendations that are reflected in this guidance and policies. These recommendations are provided as well in when strategic planning is happening. And for example, in the first paragraph, we have a compilation of all the policies that I have been mentioning, and then the recommendation of refugee response plans must include sex, age, and disability disaggregated data for all sectors, while ensuring compliance with data protection, confidentiality, and ethical standards. And additional guidance is given for needs assessment, considering both gender analysis, but as well disability analysis, to ensure that we have as well not only quantitative data on how many women and girls with disabilities may have access, for example, a GBV program, but as well that qualitative data on what type of barriers are they facing to access services is produced and used for planning. Okay, a similar guidance has been issued for an administrative instruction on detailed planning, budgeting, monitoring, and implementation for 2021, which applies to all UNHCR planning and is a mandatory requirement. Let's say those instructions are of mandatory application. So hopefully and progressively, this inclusion of qualitative and quantitative data on disability is very recent within UNHCR. Only these last 2 years have been including that. Progressively, we will be able to first enforce policies, but as well monitor what has been the impact. And going to the next slide, how this is then becoming reality. Well, I wanted to give just a small example and then sharing information of an event happening. A key way of making policy commitments and implementing in particular an age, gender and diversity approach in practice is as well through participatory processes. UNHCR routinely conducts participatory assessments, including on GBV related programming. And just to share that as well, last year, from this year, we started monitoring in particular which ones have been relevant for women and girls with disabilities. It was not easy to find. We identified 510 participatory assessments across all UNHCR, but we do not have yet detailed information on how women and girls with disabilities have been participated. However, through the policies that we shared, the instructions and the examples that I've shared, we hope to have more information on these nuanced factors of discrimination. What I wanted to share is that participation does not happen only in operations and on a routine basis. There is a commitment as well on high level participation engagement. And just as an example, on November 4th, and the registration is open. I will copy it in the chat box when I stop speaking. There will be one of the sessions on the High Commissioner's Dialogue, where Ms. Devi Maya Gurung, who is the president of the Bhutanese Refugee Associated of the Disabled, will share views on the experiences of refugee women and girls with disabilities during the session Protection Challenges and Response to COVID-19 for and by displaced and stateless people. The idea is to share what have been some of the issues shared or experienced as a refugee woman with a disability, and then how these community-led organizations have been as well responding themselves to these situations through different actions. I invite you all to participate, and I will stop here. I will share the link in the chat box now. Thank you.
Thank you so much, Ricardo. That was quite interesting. I mean, having strong policies and a good, strong framework is really a great way to advocate for more attention and for more support. In the interest of time, we're going to skip this video that we were going to show you from the Lebanese Association for Self-Advocacy, but I've put the link in the chat box there. I encourage you to watch it. It's only about 10 minutes long, and it's really quite wonderful. We had some video messages from Mia Farah, a young woman living with intellectual disabilities in Lebanon last week. And this was more information about what they're doing there in Lebanon, which is quite challenging, particularly after the blast in Beirut. So now I'd like to open it up to questions. We had a few questions that came up during the chat. So I'll start off with one that was a bit of a comment, but I thought it might be interesting for the panelists to respond. About how challenging it is to find counselors with disabilities who are actually competent as well as counseling. And Vivek mentioned that he thought it would be useful to assess in the context to make sure that you've done this within your own context. And I wonder if Lizzie and Abia have any thoughts on that.
Yeah, can I?
And Emma as well. Sorry, Emma.
Yeah, this is Abia. I just it's really important to see, I agree, because this is complicated to find the peer counselors between women and girls with disabilities who are trained, because it's a skill, and also having clear understanding, because it's kind of a responsibility to hear or provide the counseling services to other women and girls with disability. So we always train them on peer counseling. It's kind of a 1 month long training program on peer counseling. And at the same time, we also adopted the psychosocial counseling from the mainstream organizations. So these two components, when you're satisfied, they are trained and they have proper skills, then we can provide them the responsibility to do the counseling for other women with disability. So we try to monitor and also do some kind of trainings for them. Yeah, So this is not easy task to identify and just do the counseling for women and girls with disability. But we can identify, we have counselors all over the world in every country, because Japan is conducting the formal trainings on peer counseling support to the Duskin training, to the independent living training program. So we have few. So if you need any connections with women with disabilities, we can provide them.
Great, thank you so much. Emma or Lizzie, do you have anything to add?
This is Lizzie. So we as I said, we work in 8 counties in Kenya, and in all the 8 counties, we have 2 focal points who are women with disabilities, who represent the issues of other women with disabilities, and amplify cases of violations or anything that is going on in the counties. So we provide different types of trainings to these women. And recently we launched a toll-free number that can be managed by each of these focal points to kind of coordinate. The purpose was actually coordination of family planning and SRHR issues within the counties, so we can update the Ministry of Health with relevant data. But we've found that the women are also using this toll-free line to have conversations, because with the COVID-19 pandemic, as I said, there has been increased, cases of isolation or confinement in the homes. We are being told to social distance. So we found that the regular communication amongst women in the different sub-counties with the focal points has also been a way for them to have psychosocial support. So just having somebody on the other line who can resonate with your lived experience and, can possibly take forward or advance, whatever case or whatever issue you want solved, has been effective. We didn't necessarily go into it from a mental health standpoint, but we found that has ended up happening. And we have not provided any formal training, but we have now, begun looking into it. But still, just having somebody on the other end listening to you and being able to have a conversation with you, we found that has been quite helpful. Thank you.
Thanks, Lizzie. Emma, do you want to add anything to that? Or Ricardo?
Yeah, just a small addition. Lizzie and Abia have obviously covered that really comprehensively. One of the things suggestions I wanted to make was obviously counsellors with disabilities, women counsellors with disabilities, for some survivors with disabilities will be really important because of that lived experience, being able to share with someone your lived experience with someone that has, sharing that with someone that has has perhaps similar challenges, but also different strategies that they've used in their time is going to be really important. However, I would say that where GBV actors could perhaps coordinate and collaborate more with organisations of women with disabilities on this is perhaps to provide training to some of these counsellors on things like the survivor-centred approach and how to implement that with a GBV survivor, and also thinking through things like psychological first aid and safe identification and referral, and making sure that women with disabilities who are counsellors have access to information about that and to trainings on those topics. That's all I wanted to add. Thank you.
Thanks, Emma. And this next question is open to all of the panelists. Someone would like to know about, have you experienced anything about access to justice for people living with disabilities during COVID? Anything going on that you can reflect on?
Yes, can I?
Please, go ahead, Avia.
Yeah, thank you. For the access to justice, that was the most challenging part in concern of like gender-based violence, and especially in the context of women and girls with disability, because they are not very open to share their challenges. Because first of all, being a woman, and then with the disability, and from the developing country, and then the economical situation of those women with disabilities is not very strong. People already hiding them from the community to mention they have a girl with a disability at home. So in that scenario, it's so difficult for them to like mention like they are the victims of the gender-based violence, or they are the people who are facing the violation and sexual harassment and all. So in that situation, it was quite complicated, and the peer counseling was the only tool which is helpful to identify and then bringing them to the like legal systems and access to justice. So we find it quite hard to train to the police stations or the policymakers to address this issue. So from that perspective, when we talk like policy and legislation is really important, and we ask women with disabilities to have the policy dialogues with the policymakers and talk about this. So we are finding it like some of the examples where women with disabilities have done the advocacy by their own, and which was really helpful. But at the same time, it is like complicated process to address the access to justice.
Okay, thank you for that. Does anyone else want to weigh in on that?
Just sharing, Ricardo speaking, a very brief comment, not in particular for COVID-19, but I think is very applicable. One of the key issues would be, yes, informed consent, and how it has been addressed in many of the guidance that we've seen, and in many of the efforts and many of the practices as well. It has been not following CRPD recommendations. I'm going to share, there was a recommendation shared very recently on key principles for access to justice for persons with disabilities. And in particular, I think it's interesting to check how the provision of informed consent and how the process of accessing justice could be supported. There are other guidance efforts as well, but I don't want to be the guidance guy in this call. It looks like I'm just referring to books.
I'm sure, Ricardo, we know that you're more than just a guy who refers to books. Actually, this next question is something that you might be able to shed light on. There was a comment here about UNHCR's progress tool. That's the data collection tool. Maybe you can explain that a bit more to others. And about it, the fact that it probably needs to be adapted because it's only showing about 1% of refugees living in with disabilities, which is much lower than the WHO global prevalence. Do you have any thoughts on that?
Yes, and thank you so much for sharing that, Vivek. It is one of the key gaps indeed that has been identified within UNHCR's monitoring, but as well, just way of identifying persons with disabilities. There are multiple problems there. Their identification is usually done based on visual cues, and then there are certain codes that help registration officers to identify persons with disabilities, but they were not aligned or in line with human rights terminology and the concept of disability of the convention. So we have done already a guidance, and we have identified how to include the Washington Group questions. Some of them are being changed or not changed, but other questions of the standard set proposed instead, because they would not be working well in the situations where data is collected by UNHCR. What we are working on now is in the technical issues. The problem, it would be migration of all data, right? There are open cases and open files in this database, and we are proposing other codes that are equivalent, but not necessarily the same than the old codes. So it's a technical glitch that would require some issue. And what we are going to do, hopefully, if this year we can have these technical issues solved and the guidance approved, from next year it will be implemented, and there will be follow-up as well, trainings and follow-up with operations to understand what are the changes and make the best use of them. Thank you.
Thanks, Ricardo. Thanks for answering that question. As one of our last questions, I'm going to ask back to you, Abia. Does the STEP project's 3 days training, does it have a completed supervision session? And this person was also wondering if the training manual is available at all.
Hi. Yes, we have the training manual, and we can provide that to you because it's on the presentations, and also we have the training manual for the peer counseling sessions and the psychosocial both. And yes, we have done the session on monitoring. So we have like 10 women with disabilities who are doing the job of all the time to monitor when the sessions will be conducting. So we have that mechanism in place also.
Great. Well, it doesn't seem like there's any more questions, but if you do have questions, please feel free to write to me or to Emma, and we'll make sure in the third webinar that, that we answer them. So just a reminder to everyone, the final webinar of this series, where we're going to try to be quite hands-on and think about how we move forward with making sure that we are integrating disabilities into our GBV programming, is next Thursday. The same link, the same time, and we really hope to see you there. Please invite your friends and colleagues to join us. And now we're going to put a poll up to find out a bit more about what you thought of this and what we can do to support you in the future. So we'll give you a couple of minutes to fill out the poll. And in the meantime, I'd like to really thank Emma for putting this together. She's been doing so much work behind the scenes to identify amazing NGOs like Abia and Lizzie's NGO, and to bring in Ricardo to come talk to us from UNHCR. It's really great to be able to have all of you together here with us to help us think through how to make sure all of this is happening. So thank you so much to all the participants. And we look forward to seeing you next week too.
Thank you, Emma. Thank